Welcome back. In your health news this morning, March is Endometriosis Awareness Month. It's a painful condition that impacts more than 11% of American women between the ages of 15 and 44. Still, many people don't know much about it or struggle to get diagnosed. Joining us now to help break it all down and talk about the symptoms and treatment is Dr. Clara Paik. Thank you for being with us this morning.
It's my pleasure. Thank you for having me.
This is such an important topic, and for our viewers back at home who may not be familiar with what is endometriosis, can we start there and how common it is?
Yes. Endometriosis is a condition where the tissue that normally lines the inside of the uterus is found outside of the uterus, typically in the pelvis, but it can be found in other parts of the body. So it is tissue that should not be there, and we find it elsewhere. Yeah.
How common is it to find people who have endometriosis?
It depends, of course, on in your practice. As an OBGYN, it's a pretty common diagnosis for me. In California, it aligns with national data. As you said, about 10 to 15% of women of reproductive age have endometriosis. And so in California, it's about 1 in 10 women.
And so when we talk about endometriosis, what are some of the symptoms that women can experience?
Yes. So typically my patients will give a history of severe debilitating pain during their menstrual cycles. They will have missed school, work, and this can become chronic for them as well. So pain that's found not just during their menses, but before and after as well.
And those pains sometimes are very common, even if you don't have endometriosis. Yeah. So then how long does it take for people then to get diagnosed and know, okay, this is what is causing these pains?
That's a great question. Most women will, of course, know what menstrual cramps are like. So how do you determine what is a normal amount of menstrual cramps versus what is debilitating and severe? I think we just have to believe the patient. So in the past, I think people were delayed in the diagnosis because many doctors would say, oh, you just have menstrual cramps, take Motrin, take ibuprofen, you'll be fine. So it was a delay in the diagnosis. So many women don't get diagnosed until their 30s and 40s, but we're probably going to be diagnosing it earlier now.
At what point does someone say it's now time to go to the doctor?
Yes. So if they're missing many days of school, they can't go to work. My patients have said to me, I can only lie in the fetal position in my bed during my menstrual cycle. That is not normal, and you should see someone.
Yeah, and once you see someone, you can look at treatment options and all of that.
Yes.
Thank you so much for being with us and talking about this important topic. I appreciate it.